Welcome back to Afternoon Live. It is the dreaded stomach bug that can take down your entire family. Here to share some surprising facts about norovirus and how you can prevent it, we welcome Multnomah County Health Officer Dr. Richard Bruno. Thanks for being here.
Oh, thanks so much, Hannah.
This is kind of, as we said, a dreaded bug, but it's good to have the information going in so it's less scary when you encounter it.
For sure. Yeah, norovirus is a very contagious virus that can really cause a lot of gastrointestinal upset, vomiting, diarrhea, stomach cramps, fevers, headaches, and body aches. And so the good thing is it only lasts typically 1 to 3 days.
Okay.
And then it's kind of out of your system. But we really want to encourage people to make sure that they are avoiding exposure to norovirus because it is pretty contagious and it lasts on surfaces for a few days. So it's always a good idea to wash your hands very thoroughly after using the restroom or before you're eating food, making sure you're using warm water and soap, getting under those fingernails behind your fingers that sometimes gets missed. And then if you do get exposed to norovirus, always a good idea to try and isolate, stay away from folks, and make sure you're cleaning those surfaces. Usually we want to encourage people to use a bleach-based product, whether it's over the counter or you can make your own with a cup of 8% bleach and a gallon of water. And you want to let that sit on surfaces for about 5 minutes before you wash it off with hot water, just to make sure that that virus is completely killed.
So not just any old wipe that you could buy at the grocery store or the drugstore, that's not necessarily going to kill the virus.
If it has bleach in it, that should kill it. Yeah.
But you have to check the label for sure.
Check your label.
Are there certain things to look for symptom-wise to be able to know that this is norovirus versus a different, maybe less serious bug?
Yeah, often the hallmark is it hits you pretty fast.
Okay.
And you're going to get hit with those kind of vomiting, diarrhea very quickly. And you know, we worry about some folks, especially younger children and older adults, can get dehydrated pretty quickly. You know, dry mouth, not urinating very much. Maybe kids are crying with no tears. Those would be signs that kids are getting dehydrated. Probably want to go ahead and get seen by a provider or in a hospital.
What is the treatment if you do know that you have norovirus?
You just kind of let it run its course.
Okay.
There's not like an antiviral that really can be effective in that time course. So you just kind of have to let it go and try and make sure you're staying on top of staying very hydrated during that time and try not to spread to anybody else. We also make sure people are not getting back into school or into their work too quickly. You really want to wait about 48 hours after your symptoms go away before you kind of get back into society and start getting out there back into public because it's so contagious. You know, you're spreading billions of viral particles every time you may have vomiting or diarrhea, and it only takes 18 viral particles to infect somebody, so it's highly contagious.
Oh my goodness, yeah, that makes a lot of sense. Well, and that's kind of surprising to hear. A lot of folks, when you feel so sick, you want to get back to normal as quickly as you can, but waiting that extra day or two could really help your community a lot.
That's right, yeah. Play it safe, wait it out, and stay hydrated.
What about hand sanitizer? Is just good old hand washing a better bet to avoid this?
Yeah, alcohol-based hand sanitizers are not really going to kill norovirus. You really do need to wash your hands for at least 20 seconds. And then if you are making sure you're using those bleach-based cleaners to clean any surfaces.
You mentioned staying hydrated. I'm thinking about especially younger kiddos. It can be so tough those couple of days, maybe when you're really struggling. Are there ways to help them when maybe they're not able to keep stuff down very well?
Oh yeah, certainly. Any of those oral rehydration salts, oral rehydration solutions, Pedialyte, Gatorade, those are the kinds of things that you want to make sure kids are drinking, staying hydrated, and making sure they're not getting dehydrated.
Okay. Are we seeing more cases locally of norovirus, or is this a certain time of year when it seems to crop up?
There's about 20 million cases every year across the country. It's not a mandatory reportable disease in Oregon, so we don't have great insight into it, but we are following a few outbreaks that do happen from time to time, especially in congregate settings, schools and long-term care facilities and the like. I think the CDC put out a warning a couple of weeks ago because they really wanted to make sure nationwide people were keeping a close eye on it and doing the best they can to prevent it.
And what about as people are thinking about maybe winter travel plans, escaping to warmer climates? Is this one of those things that you hear about maybe on a cruise ship or one of those destination hotels that can spread really quickly?
You know, if there are shared facilities, shared bathrooms, it's always a worry that somebody may get sick and kind of spread it to other people. But as long as you're taking precautions, cleaning up, and making sure you're washing your hands after you use the restroom and before you eat, you're probably doing the best you can to prevent the spread. And typically you're going to see this in kind of the winter months, so kind of November through April typically is when we see the highest norovirus.
And you mentioned it can live on surfaces really easily too, right? Do we need to kind of be extra vigilant for an even longer period of time, even after we're feeling better too?
Yeah, it can last for days, maybe even a week on surfaces. It's pretty hardy. So those bleach-based cleaners are your best bet.
And being careful about preparing food for other people, even in your family too.
That's right, yeah. And especially we recommend for folks who are in the healthcare industry or working in the food industry, making sure that they wait those 2 days before kind of returning back to work.
Oh my gosh, okay. Lots to remember, but super helpful stuff. Thank you so much.
Of course.
Really appreciate your time. We'll have more information on our website at katu.com. We'll be right back with more Afternoon Live right after this.